Good evening, everybody. My name is Tom Yap. I'm the Foundation School Director for Wales, and I'm the Advisor on Recruitment to the UKFPO. And welcome to this webinar on supporting trainees entering practice, or the STEP form. It's great to have you here, and we're going to take you through some slides and then some questions. So next slide, please. So the list of people who will be talking is there, and they're going to introduce themselves when they come to their slides. This webinar will be recorded, and the link will be available on the UKFPO website. And we're answering some pre-submitted questions, so there will be no question answering during the any new questions to be answered during the presentation. So we will go on to the next slide.
Hi, I'm Elaine Colasso. I'm head of UKFPO. So just to give you an overview of what we're covering today, we'll be looking at what STEP as a process is, what the form looks like, who should complete it, when and how you should complete it, and also importantly, who the information that you submit is shared with and what happens next in the process. Next slide, please. So the all-important question, what is STEP? STEP as an acronym stands for Supporting Trainees Entering Practice. And that is really what the process is. It's very much a supportive process for all of those entering the foundation program and new employment as foundation doctors to ease that transition. So it's there to support you as you're transitioning into becoming a foundation doctor. We're very aware that starting as a new foundation doctor is a really nerve-wracking, in some cases, time and can cause a lot of anxiousness. So this process really is in place just to support you during that transition. It provides an opportunity for you to explain any of your previous or your ongoing challenges, and they can vary greatly. Some of those may include health conditions, for example. And crucially, what it does is it allows the foundation schools and your new employers to have the right information about you and to have some time really to understand where you may need some support or you may need adjustments to your workplace, and to have that information in a timely way so they can put effective support in place. Next slide, please. So the GMC require organisations to have a process for sharing information between the relevant organisations whenever they identify safety, wellness or fitness to practice concerns about a learner, but particularly when a learner is progressing to the next stage of training. So that's really what STEP allows us to do. Having the STEP form allows us to ensure that that information is shared and that your transition through training is supported. Next slide, please. So who should complete the STEP form? The answer to that is all applicants. So anyone who is starting in the foundation programme should complete a form. Now, if you're a UK medical student, you need to complete that form online. So there'll be a link to a form that you can complete online, and your medical school will share some information with you about that. And that information will be submitted by yourself. It will go to your medical school, and then they will submit the form to UKFPO. For non-UK or eligibility applicants, there will be an offline Word version of the form that you can download and fill in, and you will also be required to ask your medical school to complete their section of that before emailing it to the foundation school that you've been allocated to. For clarity, the eligibility application and that process includes anyone who's a UK applicant who graduated 2 or more years ago. So that if that includes you, that is the process you need to follow. You need to use the offline Word version of the form, and that will all be available on our website, and we'll show you the form a bit later on. Completion of the form doesn't impact on which foundation school you're allocated to. So we just want to take some of the nervousness away in that sense. The STEP process actually takes place after allocation. It actually starts after you guys are allocated to your foundation school, but it doesn't have any bearing on which foundation school you are allocated to. In some cases, but it's very rare, it may impact on your program or posts. But that would only be if you had really specific circumstances that required you to be in a certain post that would be able to support you because of your particular needs. But like I said, it's quite a rare circumstance. It's more than likely that it won't affect your program or post. I'm going to hand back over to Tom now. Thank you. Next slide, please.
So thank you. We've been talking about foundation schools, so we probably just need to explain a little bit about what that means, because the terms often interchange with units of application, deaneries, etc. It's nice to think of ourselves as conceptual organisations, but we are usually part of a postgraduate education provider. We organise and oversee the delivery of training to foundation doctors, so the delivery of the foundation programme. We coordinate with our NHS trusts or health boards and local education providers, so different terms in different nations, but that we link with those people who will be providing the clinical placements. We maintain links with your medical schools, and we offer support to doctors in a range of settings. Next slide, please. So in terms of the organisation roles and the step form, the UKFPO is really just there to facilitate the step process. So we collect we collect all the information to then be passed on to the relevant foundation schools. And within the foundation school, there is a director. So you have three of the directors on this call, and the foundation school director or their deputy will receive and review all the step forms. Now that's quite an undertaking for a school with up to 1,000 places, but that's what we do. There is a form on the box you can tick if you're happy for the FSD to contact you before you start F1. I would advise you to do this. The aim of this is all supportive. So we're trying to aid your transition from student to doctor and onwards. So they will discuss with you who in their view needs to receive the information contained on the form. Bear in mind in principle that we're only sharing information with those who need to know. We then pass on your form to your local foundation training program director, who oversees the delivery of your foundation program at a local level. Next slide. So within the organisation, you have an employer. Within the employer, you have a foundation training program director, and you also have an educational supervisor, and they look after your training at that local level. The program director may well feel that your educational supervisor, who is responsible for your educational development and progress, also needs to see the content of your form, so that we can put in place any arrangements to help you have a successful completion of the foundation program. However, this will only be shared with your consent, okay? And I think you shouldn't be worried about giving that consent. It's not that everyone on the team is going to know about it. This is about the educational supervisor who oversees your training over a 1 or 2 year period. Medical staffing and occupational health, sometimes it will be discussed with them, but it is not automatically shared with medical staffing and occupational health, okay? Occupational health are often involved because of the need to make reasonable adjustments for their employees. Again, this is only done with your consent. So I'm going to hand back now to Elaine.
Next slide, please. Thanks. So just to quickly recap what Tom had mentioned, that information will go to your foundation school. It will then be sent on to your employer and shared with your FTPD and the medical education team. And then with consent, it may be shared further, and that would be to anyone just necessary, so someone like the education supervisor or perhaps occupational health. Next slide, please. So the step form itself has 4 sections to it. There's a health section, a welfare section, personal performance and skills, and then lastly a professionalism section. And once that's completed, whether that's online or via the offline paper version, the Word version, I should say, not paper, Word version of the form, that needs to be reviewed by your medical school, whether that's your nominated medical school or if you're a non-UK grad, the medical school you studied at, and then the staff members there need to approve it before you then either submit it via the online version or, as I mentioned, email it to your foundation school if you're an eligibility applicant. Next slide, please. So just to let you know about the guidance, the STEP guidance is actually available on our website already. There's a link for it here, so that will be available once the webinar recording is there, but you can already look on our website for the STEP information. There's a dedicated page with tiles that take you through the various steps in the process, pardon the pun, and then there's a separate page there within that deals with each section of the form, so the health, welfare, personal performance and skills parts and the professionalism part of the form. Next slide, please. So the timeline around this, again, also available on our website. The process for STEP starts on the 18th of March. So the online forms and the Word version of the forms will all be available on the 18th of March on our website. If you're in the UK, your medical schools will liaise with you around the internal STEP process, so the timings around it, and they will let you know a little bit more about the STEP process as well and completing the form. So please do look out for emails and guidance from your own medical schools about that. So the process will start in March. There's a deadline of the 10th of May, Friday the 10th of May, by which all forms need to be submitted and approved by the medical schools and submitted on the online portal. So it's a sort of staged process. The applicant or student fills in the form first, they submit that, and then the medical schools review it and submit that via the online portal. It's really important that you fill your form in as early as possible to allow your medical schools to review the form, and if needs be, they may want to have a conversation with you about the contents of the form if they feel that anything perhaps would be more helpful to add or not before submitting. So it's really important you give them some time to review that carefully, come back to you if needs be, and then have a final sign off of the form. So please fill that form in as soon as you can to allow your medical school time to do that, and then they have to submit all forms by the very latest on the 10th of May. The foundation schools and your employers then have between May and July to review the information that you've submitted and discuss and put in place any reasonable adjustments that may be required for the start of your training programme. Next slide, please. So this is a little bit of a view of what the form will look like. Hopefully you can see it's hopefully quite simple for you to fill in. So some personal information about yourself at the beginning, i.e. names, GMC number if you have it, email address, contact details, that sort of thing, and which school you've been allocated to. It then moves into the health section where there'll be some parts to fill in. Next slide, please. And then goes through the other sections in turn. So welfare, personal performance and skills, and then professionalism. There's then an applicant declaration at the bottom. Please don't forget to fill that in and complete that fully. And make sure you go through each question in each area carefully. Like I said, there is guidance for each section on our website, so please do look at that before filling in each section so you're aware of what's expected in each section, and there'll be some helpful hints there for you to help you, to guide you to fill in the form. Next slide, please. And then lastly, it's the medical school declaration area where your medical school will be able to go on, fill that in once they've reviewed the contents of your form and then submit it. I'll hand over to Dr. Van Hamel. Thank you. Next slide, please.
Hi, I'm Claire Van Hamel. I'm the Severn Foundation School Director. So I'm just going to talk briefly through a few examples of people who I've supported with information that they put on their step form. So there was a doctor who would need hearing loops, and obviously it takes time to fit the hearing loops in the areas that the doctor's going to be working. So they declared that on their step form, and we were able to liaise with their employer to make sure that there was appropriate sort of hardware put in, if you like, in order to facilitate their being able to work. And then I've had more than one example of doctors who've had ongoing health appointments that they can't miss for their own well-being, and by liaising with the employers early on in the process, they could see how it could be managed within the work schedules, rather than turning up on the day and finding that the rotas were written, and actually it caused quite a lot of sort of stress for people to try and change rotas at short notice to enable those doctors to arrange appointments. Obviously it's important that people look after their own health, but it's actually easier if we try and arrange these things in advance rather than trying to sort out a rota once it's been written. It might be worthwhile thinking if because of health reasons or for other reasons you'd like to work less than full time, that you consider that as part of the step form. It's not the application to work less than full time, but it's an opportunity for you to share that you're considering working less than full time and may want to discuss it with the foundation school or with your foundation programme director. So it could be worthwhile adding this to the form. Another example is last year I had a few people ring me and say that they were feeling incredibly anxious about starting. They were worried that they were losing their contact with their friends, their familiar environment. They really didn't know whether they were going to start. I was able to put them in touch with the foundation faculty and the trust that they were going to be working in, and both of them have been completely fine, and yet they were both at a point where they felt that they may not start the foundation programme because of their anxiety about being in a new environment. So it is normal to feel anxious. Some people feel more anxious than other people, but we are here to support you. And if you are feeling, particularly anxious, it's worthwhile, reaching out, because we can often, sort of reassure people and make sure that the support is available, and you can meet with the sort of faculty in the trust you're going to be working in, and turning up with a familiar face, even if it's a Teams meeting before you start, can often make that transition so much easier, really. Next slide, please. So what STEP does not do, so it doesn't replace the need to report any fitness practice issues to the GMC, and anything that needs to be reported to occupational health. So there are certain health things that have to be declared to occupational health so that they can make adjustments to your working practices to make sure that you don't come to any harm, and also your patients don't come to any harm. So if you've got those things, it's not that you can't put them on the step form, but it doesn't replace the need to declare those things. It doesn't guarantee that you're going to get all the adjustments that you have had at medical school or that you might wish for your working environment. The request is that reasonable adjustments is made, and so that has to work for the employer and the employee. So it's not all about what you ask for you will get, but hopefully you'll come to a reasonable compromise in terms of something that will work for both the employee and your employer and yourselves. It does not guarantee that you're going to be allocated to a particular placement or a particular rotation, or that a particular adjustment is going to be made. So as already mentioned, less than full-time training is a separate process. Mention it on your step form if it's something you're considering or want to talk about. But if you do decide to work less than full-time, there is a separate application process that will be available from your foundation school website. So say, by all means, liaise with the foundation school, but don't forget to fill in the form, because ultimately it is a requirement to fill in the form to request work less than full time. And don't think that everything that is in a pre-allocation form will automatically get passed on to the trust. So you might have been pre-allocated to your foundation school, but that will not necessarily be, that information will not necessarily be transferred to the trust. So if you've got things that you think would be important for your foundation programme director and your trust to know, then please put it on the step form. Duplication is better than not having it there at all. So as I say, it's better to be upfront and open about about any challenges that you might have. Next slide, please. And here is an example of an anxious dog. He happens to be my own anxious dog, but he's always desperate for reassurance. And a lot of you will be desperate for that reassurance as you're moving on to the next stage of your career. And if you don't tell us that you need reassurance or need support, then we won't be able to provide it. So don't forget that actually, if people reach out and say, you know, I need some help, we're here to support you. That's what our role is all about. I'm going to hand over to Ali now.
Thank you, Claire. Hi, everybody. I'm Ali Carson. I'm the Foundation School Director for London. Just going to go through a few case examples with you in a bit more depth. So the first one is an individual that I've looked after or supported recently, who was a UK graduate who did comprehensively complete a step form so that we could meet with them shortly after they had been allocated to a programme. So that was in the April period. And they'd had quite significant reasonable adjustments made at medical school, and part of their anxiety is, well, what reasonable adjustments could be provided by the employer and by the foundation school when they started. So we were able to do a support meeting relatively early on and then signpost. So for those that aren't yet working on it, might not be aware, there's a government access to work scheme through which people can be supported to financially in getting software and laptops and so forth to help with the reasonable adjustments. It also meant that the trust were able to provide sort of software relatively. So these processes can often take a little bit of time to go through occupational health. So being able to start all of these things early meant that by the time this doctor started in the August, things were already in place for them when they started. And in addition to meeting with the school, as Tom alluded to earlier on, the employer will be the trust, and meeting with the local training programme director in that trust can also help with those support meetings and being able to signpost to the right individuals and access support as needed. So this was a case where things worked very well for this individual by having all of that information early on. Going to move to the next slide, please. In contrast, this is another doctor that I've helped and supported over the last couple of years that came to me retrospectively, having not completed a step form, and really felt in hindsight that they perhaps should have done. So they were an international medical graduate who's perhaps less aware of what support is available. They did have issues at medical school, both from a health perspective and needing to resit years through there, but partly because of worry about a stigma, and that's partly why we're here, is to make sure that we can reassure you that there is no stigma, there is no penalty for sharing this information. This really is about identifying areas that we can help in early, but because of their concerns regarding that, they didn't complete a step form. What that did mean is that when they did start in the trust, it's quite noticeable to colleagues and their supervisor that they were struggling relatively early on, but their occupational health referral wasn't made until their second post, which was about December time. And as I mentioned, because sometimes these processes can take a little bit of time, it did take quite a few months for reasonable adjustments to be identified and implemented, by which point this individual had quite a significant period of time off work and then needed an extension time to complete F1. So we were able to support them, but it just took a lot longer. It did mean that path to getting there was longer and trickier than being able to identify these things early on. For the third case, the next case, we go to the next slide. I've actually got one of my doctors to actually talk to you about their experience, so you won't need to keep listening to my voice. Hopefully somebody clever is going to be able to play the audio.
Hello, my name is James and I am a Foundation Year 1 doctor in London. I have several disabilities, a visual impairment, ataxia, and dyspraxia. I'm going to say a little bit about my transition into clinical practice and then share some advice. So I accepted a place on the London Specialised Foundation programme in January 2023. I then contacted the foundation school early and a meeting was set up with the foundation school director, who is Dr. Carter, and with the academic lead in February 2023. After medical school finals, I completed the step form, now putting into writing exactly what was discussed at the February meeting. The foundation school director connected me with my FY1 trust and an occupational health appointment was arranged. Occupational health then made recommendations for reasonable adjustments. For me, this included special computer software for magnification and dictation, and also release from clinical duties in order to attend medical appointments. These are just two examples. The occupational health report was shared with my FY1 trust, with the foundation school, and with the GMC. The trust then started to implement the reasonable adjustments, and the GMC issued provisional registration, allowing me to start the FY1 post. So my advice on what to do: number one, be open and honest. We may all feel a reluctance to share information about our own health or disability. There may be anxieties or fears about punitive consequences or stigma. In reality, the focus is on support, and if the foundation school doesn't know about a disability, they can't support you. Number two, be comprehensive. The step form isn't just a tick box exercise. It's a tool to identify incoming trainees who may require additional support and what sort of support may be needed. So if you have had reasonable adjustments in place at medical school for whatever reason, some which were helpful and others which were trialled and then discarded, then write all of that down on the step form. Number three, be early. The time frame for identifying and delivering reasonable adjustments and support is probably more in the region of weeks to months rather than hours to days. There are a lot of parties with an interest: the foundation school, the GMC, occupational health, the access to work scheme. Do not leave tasks like completing the step form to the last minute or forget about it completely. So my take-home message is that the foundation schools do genuinely want to support incoming trainees, and there are a lot of ways in which this can be done. The most important first step is for the incoming trainee to share information openly, comprehensively, and early on.
Thank you. James couldn't be with us today because he's on annual leave, but very grateful to him for being able to share with us his experience and how he's managed to benefit from all that early communication. And then next slide and final slide from us is really to re-emphasise, I think, hopefully, that this is very much a supportive process for all of you. We are here to help. We do appreciate that it's an extraordinarily anxious time. There's an awful lot of changes in a few months, from thinking about your finals to thinking about your new job and thinking about where that might be. We are here to help. Please do ask us questions. I know some people have submitted them already, and we'll answer some of the questions that have come through. But if there's any more outstanding issues, then do please contact the school that you'll be allocated to, which you'll find out in the not too distant future. Okay, I'm going to finish there and hand back to Tom, who's going to chair the questions.
Thank you, everybody. So that's the presentation, and we're now going to go to some questions that were submitted in themes. We sort of grouped them together in themes, so I'm going to read them out and then I'm going to pass them over to the panel to provide an answer. So question number 1 is, will I be able to speak to occupational health in the first few weeks of my career as a junior doctor to arrange support for my disabilities? And that's over to Claire.
So in answer, yes, please do as early as possible. Really is the information that we can give you. As soon as you're matched to a programme and you know who your employer is, you can make contact with the Foundation Programme Director in the Trust and the Medical Human Resources, and they can arrange for you to contact occupational health. So it's never too early. If you've got issues that require occupational health, they will contact you, but sometimes it's better to be proactive, particularly if you're anxious about a particular health condition. Then it might be better for you and better for the trust if you are proactive in terms of making that contact.
Thank you, Claire. So the next question is, does the step form require any evidence? And that's for Elaine.
No, it doesn't require any evidence to be submitted. So there's actually no function on the form itself to submit any uploads or any additional documents. But what you can do is, if you feel like there is pertinent information that you do need to pass on to your foundation school or to your employer, you can obviously, once you know their details, contact them separately and send them any supportive documents that you feel that would help you in the transition and would be helpful for them to have.
Thank you, Elaine. Next question is, what support is there for trainees with mental health conditions? How will they be supported in being able to attend appointments for treatment, e.g. psychology, during their rota? And that's for Ali.
Thank you, Tom. So hopefully we've reassured you that this is an employer responsibility. So every employing organisation will have a policy for requesting time off to attend appointments. The earlier that you can let people know, the easier it is to accommodate in work schedules and so forth. So please speak early with your local team to organise this. It is important to put it on your step form so that we can also communicate that with your employer and help support you with that. But earlier the better is really the best advice.
Thank you, Ali. And on a similar theme, what allowances are made for trainees who need hours out to attend medical appointments on a semi-regular basis? For Claire.
So each employer will work with you individually to work out how to make those adjustments to your rota such that you can attend appointments that are required and minimise the impact to your training opportunity. Really, you can agree a plan of action around your work commitments. Obviously, it's better if you know when those health appointments might be, so that the trust can try and provide a rota that suits that. But if you aren't certain when those appointments will be, there is a requirement for people to release you to attend health appointments. So, looking after your health is very important, and so please speak to your employer and give them the information that they can to work with to try and adjust your rota to make sure you and the employer are sort of able to deliver service and keep patients and yourselves safe.
Thanks, Claire. And it's also worth asking your healthcare team whether they can make any accommodations. Next question is, what adaptations are made for doctors with physical disabilities which may affect their mobility for long periods of time? And that's for Elaine.
Thanks, Tom. So there isn't a one-size-fits-all approach to this. The adaptations could be really varied depending on your particular needs. So it's really important you provide that detail on your step form. The foundation school can then work with your employing trust to look at what adjustments would be needed during your placement to allow for your disability. And that can take some time. So the more detailed and the better the information provided is, the better able rather they are to support you in looking at the adaptations that are possible for your particular placement. So it's those particular situations are very important that they get that information as early as possible, because they, like I said, they can take some time.
Thank you, Elaine. Can a doctor still progress through their foundation year if they have had sick days for medical conditions? Is there a minimum requirement for this in addition to the other usual requirements? For Ali.
Thank you, Tom. So again, there's not a one-size-fits-all answer for this, and it's very much an individualised approach. So from the foundation curriculum perspective, it states that when somebody reaches 22 days, that's time out of training days. So these are working days where you may have been on sick leave. So I'm sure this is not annual leave. So once you reach 20 days, that will trigger a review. That review usually takes place at what's called an ARCP, the annual review of competence and progression, which every foundation doctor will have. And that panel, the ARCP panel, will review your e-portfolio, so all your evidence from supervisor reports to structured learning exercises and so forth. And it's all of those factors that will be used to determine whether an individual needs any extension time or not. So it's not a one size fits all. And if you are worried, it's again, one of the situations that's worth discussing with your foundation school early in your year.
Thank you, Ali. Next question, for learning difficulties such as dyslexia, ADHD, etc., realistically, what support adjustments can be made during foundation jobs, especially in ward-based jobs? It doesn't seem like much can be done, or if declared, who will this information be shared with? Would I have any control over who I would like and not like this information to be shared with? And this is for Claire.
Okay, so as mentioned already, the information will be shared with the foundation school and then the foundation programme director, but any further sharing would then be done with your permission. So the amount of sharing that needs to be done will really depend on the extent of the adjustments that need to be made. We've already shared some examples of some adjustments that need to be made, but these would really have to be discussed with your employer in order to understand the specific requirements, because although there might be some sort of overarching headline, sort of diagnoses, if you like, the actual individual requirements may differ significantly depending on the degree to which you are compromised. So say it isn't a one size fits all, and adjustments will be made according to your own need. And can I just sort of mention, in terms of sort of extensions to programme, people get very sort of tied up and worried about it. In reality, medicine is a long career, and if you do need to have a little bit more extra time as a foundation doctor, then really you won't even be thinking about that, sort of in a year or two's time. So say don't get hung up on sort of how many days out. If you need days out for your own health, then it's much better to be looking after your own health and worry about whether you need a short extension. Sorry, that's a bit of ad hoc, Tom.
Nothing like a bit of impro. Right, okay. I'm worried that if I declare something such as dyslexia, and then if a mistake is made with a patient, that this would be brought up and blamed. Are there ways to ensure anything declared is confidential and won't be used against me in the future? And this is for Ali.
Thank you, Tom. I feel very sad to read that question or hear that question, because I hope we've reassured you that this really is about supporting you, and this is not at all punitive or leaving people susceptible to any difficult situations. So I think we understand there is anxiety whenever you're wanting to share personal information. Hopefully we've reassured you that it stays in the foundation school and the TPD, and anything beyond that will be, you know, explicitly with your permission. But this really is a supportive process for you, and to be able to enable everyone to be able to deliver safe patient care, which ultimately is what we're all here for.
Thank you, Ali, and thank you for that reassurance. During medical school, if I have had reasonable adjustments, such as extra time for exams, would I also be given extra time to complete required foundation training assessments, portfolio requirements? And this is for Elaine.
Thanks, Tom. So the adjustments you may have had at medical school, it's really important that you put those on the form so we can understand better what support you've received at medical school and how that might translate into your foundation training. But also important to note that those adjustments may not be quite the same within your foundation program, and that is for your employer to individually assess alongside you. So it's really important you note those down, but I think as everyone's already said, and as some of the examples have shown, the adjustments can vary. It will absolutely depend on your particular requirements, and your employer will do their best to make sure that you have everything in place to support you for your programme.
Thank you, Elaine. And just to reassure you, when you come to the foundation programme, much of the activity you do through your portfolio is formative learning. So it's about what you learn from your experiences and your reflection, rather than it being a summative pass or fail assessment. Anyway, next question is for Claire. I have been told by some trainees that it is best not to declare things that could be used against me in the future. Is there a risk of this happening? Another theme, I think.
Yeah, no, things won't be used against you. In actual fact, it's far more likely that if you don't declare something, that you know, that could compromise you in the future. So any rumours that you've heard about, you know, not sharing information because you're worried how it's going to be used, please, you know, not only ignore them, but also you know, dispute them to other students who might also be worried about sharing information. The information is only used to support you in your training. It's about making sure the appropriate adjustments are made so that you and your patients can be safely looked after.
Thank you, Claire. And again, this next one, I think we have covered it in part, but what is the procedure for entering less than full-time training? Does the step form help with this process? And this is for Ali.
Thank you. So I think we have covered this. So working less than full-time these days, you don't need to have a specific reason in which to do it. You can request it for variety of reasons, but do let the school know early, because it will mean that the trust needs to be informed and your programme adjusted accordingly. So there's a separate process to request less than full-time. If you are thinking about it and you want to put it on your step form, that's absolutely fine. But again, when you're allocated to school, it's worth letting them know then, and each school will have a different application process for that.
Thank you, Ali. And our last question for Claire is, if you are unable to do nights because of health reasons, is STEP the form to share this information on?
Nearly didn't unmute. Yes, please do share the information on the STEP form. We've had a number of trainees over the years who are unable to do nights. It's something that, you know, sort of is better sorted out sooner rather than later, because once the rotas are written and everybody's been given that information, to then remove someone from being on the you know, nighttime rota is much more disruptive. So it's much better to declare that really early. You know, it'll probably need an occupational health assessment to confirm that, because otherwise a lot of people might decide that they don't want to work nights, but there certainly are people for whom working nights or, you know, out of hours is not the right thing for their health, and we can make adjustments, but say the earlier you let us know, the better, basically.
Thank you, Claire. So we've come to the end of the questions, and we're nearly at the end of the webinar. I think, you know, that the themes to remember are that this is a supportive process. It says supporting trainees entering practice, and that's exactly what we want to do in your transition from student to doctor. The earlier we know about things, the better, because we can start to get the ball rolling and try and put any adjustments or extra support in place before you start. And as we've always said many times, it is not one size fits all, and we consider everybody as an individual case. So whether the form, whatever the form includes, we will consider that and discuss with you how that might impact on your ability to complete the foundation programme successfully. I'd like to say thank you very much to my panel members for their contributions. This has been recorded and will be available on the UKFPO website, so you can tell your friends who didn't manage to attend that this valuable archive is available, and to the 152 of you who've stayed on to the end, congratulations. But you can finish, we'll finish now at 6:45, and thank you very much.